it's on the honor system. But I also always promise to tell you guys something that will probably freak you out a little bit and make you a little bit angry at the system that you're living in right now. So, this is an estrogen, progesterone, testosterone test kit, and I'm going to talk about all things hormones. So, yay, hormones arriving tomorrow. Yay to come. I'm so happy. That's so exciting. Okay, so she's talking about we have our hormone. Oh, and just mailed my test kit off today. Yay. Um, I'm so excited for you guys. This is awesome. I feel like I get to make such a difference being here every night and sharing information, and you guys just keep showing up. Hi, Constantina. Um, just my tribe. I love it. So yeah, so if I don't teach you something new, free test kit, promise. Okay, so that's cool. So absolutely. Crazy information. I just love this nerdy science stuff. I spend so much time. Oh, yay! You got your hormone kit in. I love it. I love it, Carol. That's awesome. Okay, so heart health is so important. Why? Because it's the number one thing that is most likely going to kill you after menopause. That's just it. So let's talk about the most dangerous thing. Forget breast cancer. Don't forget breast cancer. But if you are really worried about potentially what you could die of, then this topic is something that you absolutely have to know about. Okay, my warning is there is a lot of nerdy science here. And I always say, sometimes my patients like look like a deer in the headlights because there's so much information. But my warning is I know it's a lot of nerdy science. There will not be a quiz. I always say that afterward. But I just want to give you an idea that there's so much more to the story than you're being told. And I kind of feel like if I don't give you, hi Connie, I kind of feel like if I don't give you enough nerdy information, I think it kind of honestly ups my street cred a little bit that I've actually researched this and I know what I'm talking about. So I do try to make it like applicable and where you can understand it as well, because this is, like I say, like years and years and years of research and science and being in the medical stuff, right? So, but this could save your life. Absolutely share this if you know anybody that could benefit from it. There's a little arrow there. You can send it out to your friends while I'm talking, and I post the live replays later. So I love it when you guys bring a notebook and a pencil and take some notes because I'm the nerdy scientist professor that likes to teach. And I think there's always something that you can take away from there and the notes later. But again, we post the live. And if you do the little like thing and then you tap the screen and show some love, the little hearts come up. And that tells the algorithm that I'm talking about cool stuff. And sometimes, like, if I say something they don't like, they won't push it out to people anymore. So the people who come on the lives, there's thousands of you guys that come on. And so, like, the more we can get to hear this message, the better. And so when they kind of cut me off, it's like, that's so sad. But anyway, okay, enough about that. I promise. Okay, now we're going to get into the meat. You guys ask your questions if you have them. If I don't see them, my wonderful fancy moderator will repost them if he sees them and I haven't answered them. But always bring that back around too, because this is your time. I'm going to answer your questions, but I do want to get through some of the crazy nerdy science and the meat so that you can have some takeaways and be like, oh my gosh, I didn't know that. And then you go tell people some crazy stuff later. So my goal for you would be to take one thing out of this and go share it tomorrow, because I'm going to give you a lot of like crazy information. Actually, my goal is that you go research this and find out for yourself, because not because you don't trust me, but because that starts that seed in you that makes you want to research this stuff and it makes you want to know more. So if I can plant that seed, then I've done my job. If that gets you doing a little bit of research, yay! Thank you. So anyway, okay. So just be listening for that one thing that you're going to take away and go research a little bit, but definitely share with somebody and say, yeah, this crazy doctor said that. So, okay. Anyway, hormones and the heart. So I just said that heart disease is, hello from Texas. Hello, Texas. Hello from Arkansas. Okay, I just said that hormones, that heart disease is the number one killer in women. And I'm going to tell you why that is. There's a very specific reason. It's not just like something they put in the news and it's like the number one killer in women. There is very specific reason. 75% of heart deaths, heart attacks occur after menopause in women. Okay, are you starting to see there's something going on here, right? Like I'm just that girl, I'm very curious. And like when I have like something that kind of triggers me to go, that seems strange. That's one of those things. Okay. And here's another thing. Again, when I said breast cancer, that's not an important thing. But here's the deal. The death rate of women, and I always say, you guys who know me, that menopause is just a year without periods. It is a term that I would really like to get out of the scientific vocabulary. Ovarian failure is what happens after menopause. We have no ovarian hormones anymore. They're done. They're gone. And when we think about that and we think about where we are with what happens after that, we have the highest incidence of breast cancer and heart disease after ovarian failure. To feed the pause, I love it. After ovarian failure, but breast cancer is about 14% of women in ovarian failure. But heart disease is not even making this up, 86%. So everybody's worried about breast cancer and hormones. We're having the hormone talk, right? But shouldn't we be scared of heart attacks? Because it's a really big deal and nobody really talks about heart attacks in women. Now, here's the deal. People will be like, well, I know people with breast cancer, but I don't really know a woman who's had a heart attack. What we're talking about is heart disease, and heart disease is what can lead to so many underlying conditions, including strokes, which are very common in women. So when we're talking heart, I'm talking all things vascular, not just heart, and all the processes in your body that require your vascular system to feed. So that's your bones, so fractured bones, and then also having risk of clots and so many things associated with this. So it's not just the heart and heart attack. It's bigger than that, right? Okay. So I'm going to explain why. And I know these are small, and I don't expect you guys to really see these. I kind of want to just zoom in, but so I want to compare, and this isn't going to make a whole lot of sense until it all comes together. But I want to compare women and men and what happens in their hormone life cycle. Because men have more heart attacks when they're younger, not in their 30s, but in their 40s and 50s. It's not uncommon to hear of a man who has heart disease or high blood pressure in his 40s. It's not as common in women in their 30s and 40s to have heart disease or high blood pressure. So why is that? Okay. So, and it's also more common for women after the age of 50 than men to have heart attacks and strokes. And that's what's killing us, women, right? Okay. So men and women have all the same hormones, sex steroid hormones. And what that means is your estrogen, progesterone, testosterone, pregnenolone, DHEA, and we could go through the whole list. But men and women have all the same hormones. But here's the deal. Couple different facts we have to talk about first is that women actually have more testosterone than estrogen. I'll say that again. Women have more testosterone, make more testosterone than estrogen. Now, men have a lot more, but women, apples to apples, estrogen to testosterone, we have more testosterone. What happens after our ovaries fail? We have nothing. And so that's when we start to see all these disease processes. No estrogen, no testosterone, no progesterone. But actually, most women do have a little bit of testosterone after menopause because we have more testosterone. So if you're going to have a little bit of anything, it's going to be more testosterone than anything. Testosterone was 9. Yeah, that's pretty low. we want to get that up. That would be very, very nice. And, to come, you've seen some of my stuff on testosterone and the benefits of that. So show many things to this. Okay. So the interesting thing is that and you guys have seen me draw this picture a lot, this is the graph with the ovarian hormones, and this is from birth to 100. So this is testosterone, estrogen, and progesterone. Now I only put the values, what the normal values are here, when someone's fertile or when they're younger. Okay. So for example, when a woman is fertile, her testosterone is 20 to 40, so much different than a man's. So a man's is 200 to 1,000. Sorry, I missed a zero there. A woman's estrogen is anywhere from 30 to 600, depending on where she is in her cycle. And a man's estrogen is 20 to 40. So very different numbers here, right? And then progesterone, I'm going to leave progesterone out of the conversation, but I did want to talk about that because that is one of the main ones that plays in here. Okay, so a woman after a year without periods in ovarian failure, you're born with all the eggs you're ever going to have. When you're out of those eggs, your ovaries literally dry up and go poof like a little raisin. They're just not undetectable. And I always say if a radiologist does a read on an ultrasound in a woman's pelvis after the age of 60, they won't even see the ovaries anymore. They will say ovaries not seen or ovaries not detectable. They are not functioning. You are in ovarian failure. And that is what we're dealing with, not the word menopause. You're an ovarian failure. And I always say if they took your thyroid out, they would not give you thyroid hormone, right? And they would not test you. They would not just throw like 100 micrograms of levothyroxine at you and go, oh, I think that should do the job, right? Is that helping your symptoms? Yeah, like you're not like, you can get out of bed now, right? So that must be the right dose. And that's what women are dealing with. And that's why I'm so passionate about let's check your levels and then let's get you some treatment and then let's check your levels again. Because I'm like, this is an endocrine organ, much like your thyroid. So stop the madness, right? Okay. So anyway, my little rant, you guys know I have to do that. So we have nothing. We are completely flatlined here. And this is where all the disease processes happen here. This is where the heart attacks, the breast cancer, the strokes, the dementia, this is not where it happens when you have all these normal hormone levels. So that's kind of your first eye opener. So it's like, what do you do with that when like they're telling us that hormones cause cancer? But if that was true, well, and what hormone, right? Is it estrogen? Is it progesterone? And I know I told you guys this other night, but the WHI study from 2002, it was actually the synthetic progestin arm that they stopped. It wasn't even the estrogen arm. So like it's like if we're gonna talk about what hormone is scary for breast cancer, let's talk about the right one. Testosterone made my blood pressure shoot up. I'm glad you said that, Marcia, because I'm going to talk about that and what causes that. Um, Oh, thanks, Connie. Okay, so the reason I'm telling you about men is because men, this is so unfair, but nobody asked me, what was fair, right? Okay. I grow a full beard to feel better. I love that. Okay, so men, okay, if you're looking across here, okay, see that line there? So this is women flatline. So men have testosterone levels that spike after puberty, and they kind of do start declining around the age of 30. But even up until 100, men still have quite a bit of testosterone. Unlike us, we're completely flatlined. Okay, so men have estrogen too. So they have estrogen that's a lot lower than their testosterone. So men are 200 to 1,000, and their estrogen is 20 to 40. So that's 20 to 40. And this is 200 to 1,000, depending on where they fall. And their progesterone kind of rides under here. I only put that on there because I wanted to, kind of keep it consistent. So look at this. Men never flatline like we do. And I always say if a man had to live without testosterone, if a man had to live with his hormones flatlined, we'd have a much different world, was they say man's world, right? So I mean this is the comparison. So this is the difference why women have the heart attacks here, but men keep a consistent level of estrogen. So, okay, spoiler alert, all of this tonight is going to talk about estrogen. So I had to tell you that not having estrogen is the problem. And that's why guys still have estrogen and have less of these problems. Okay, another thing if estrogen caused breast cancer, then why wouldn't men? Now, I mean, it happens. It's rare, but it happens. But why wouldn't men get breast cancer if they actually have estrogen higher than ours after menopause? Crazy, right? Okay, so anyway, that's where we are. So this is a picture of why we need estrogen. Okay, so I got a little out of order with my boards tonight. And this is what's going to answer that question about the blood pressure. But first of all, I want to go here because I want to talk about the elephant in the room when it comes to talking about heart disease. Okay. So let me just tell you that cholesterol is actually not a fatty globule ready to cause a heart attack or a stroke. It is not. You know what it is? It is a hormone. And any doctor who ever tries to put you on a statin and your key into their little world, sorry, I don't mean to be snarky, but if someone ever wants to put you on a statin, I want you to ask them, is cholesterol actually a hormone? And then see what they say. And if they deer in the headlight you, run, because they're trying to put you on a medication that they don't understand. Are triglycerides as dangerous as cholesterol? I'm absolutely going to talk about that too. I'm excited to talk about that. Okay. So, and basically, if in case I forget, let me just address that, Constantine. It's they're all different parts of the lipid panel. So I'm going to break that down for you so you'll see. Okay. What do we got here? Okay, cholesterol. Okay, so that word sterol is steroid. If you've ever heard the word steroid, so like guys in the gym take steroids, testosterone is a steroid. I'm gonna draw a line here. Testosterone is a steroid. And that word sterol means that these are steroid hormones. And there's different kinds of hormones. So thyroid is a peptide hormone. Steroid hormones are our ovarian or our testicular male or female hormones. And then this pathway, cholesterol turns into progesterone, and that turns into estrogens. Remember, there's different kinds of estrogen. And then that turns into testosterone. But here's the kicker. These are converting back and forth all the time. Now, can you imagine, and this is done in the liver, so this is where the liver comes into play. So after you've gone through menopause, a year without periods, and you're an ovarian failure, the good Lord gave us a backup plan, which are something called adrenal glands that sit on top of our kidneys. They're little tiny, like the size of a pencil eraser, and they produce all the same hormones that our ovaries once did, but mostly produce DHEA, or what we call androgens, or more the male hormones, male steroid hormones, right? Males and females have all the same hormones. But so those androgens go to the liver, and if your liver's functioning properly, which is super important. So one of the things I said in the teaser description today was that high blood pressure and heart disease are not a heart problem, they're a liver problem, because your liver is actually making what little estrogen women have after menopause to protect you. And I'm going to show you how the blood vessels work, and I'm going to show you how the intracellular DNA of the vascular lining work in just a second. Okay. So, and the liver also makes cortisol, as well as does your adrenals. And cortisol is your body's natural anti-inflammatory. So inflammation has a very big part to play in this as well. Okay. So if this is the case, and someone were to put you on a statin, which is a cholesterol lowering medication, can you see that after menopause or in ovarian failure, if your liver is trying to suck from the adrenals and convert cholesterol into estrogen and testosterone and progesterone for you, can you see if you put somebody on a cholesterol blocking medication, because most of your cholesterol is made by you, not by your diet, not by what you're eating. It's made by you, your liver. Most of your sugar is made by your liver too. I mean, you are just a little like fatty, sugary production, body. I mean, it's not. So, I mean, it's like we do eat fat, dietary fats, and we do eat sugar. but a lot of that's made internally. That's kind of one of the reasons why people say, I woke up, diabetics, I woke up and my blood sugar was really high this morning and I didn't even eat anything. It's because your liver made sugar overnight. So it's just fascinating how all this works, right? Okay, so if you block that and you don't have those hormones, you can see how big a problem that would be, especially in a woman. And there is no data. I beg you to bring me the data that says there are improved cardiac outcomes in females. Now, there are some questionable stuff in males, and I've seen plenty of data in men over the age of 70 who've had what's called CABG, coronary artery bypass grafts, or open heart surgery, that statins do have some improved morbidity and mortality. But in a woman, none. And you know why we don't have those studies in women? I'm not saying maybe I understand the physiology, but maybe there's some out there that are funded by big pharma. No, I'm just kidding. Maybe there are some out there, but the reason they don't do those studies on women is because it's dangerous to babies, to developing DNA. And so those statins, they can't do that on women because of the risk of a woman getting pregnant during a clinical trial. So there aren't any. And if you want to bring it, bring it. I'd love to see it. I mean, promise you, I'm the nerdy girl who's done, I've begged for it to come out of the woodwork and nothing. And so anyway, that's where we are. So what happens is after menopause, when we're in ovarian failure and we are not having the privilege of having our ovaries make those hormones anymore, the body kicks up its own internal production of cholesterol to make these hormones because it knows you need them. Now, if that happens and your body kicks up its cholesterol production, isn't that the perfect time for the commercial system to start checking cholesterol levels? Because, yeah, your body is going to make some, and it's going to make a lot because it needs to, because it's trying to protect you. And then what do? We block it? Like, what the heck? That makes absolutely no sense. And those cholesterol medications have tons of side effects because the way they work through a system, and we kind of get in genetics. I think I have to do genetics tomorrow night because, like, I love genetics. So genetics play in here a little bit too. But there is a system in which your body clears medications and toxins. And in that system in your liver, it's called the cytochrome P450 system. You don't have to know that. But in that system, those cholesterol medications are extremely toxic. Triglycerides are super high, and I watch what I eat. Okay, we're going to talk about triglycerides in a sec too. So those medications, as they're trying to get cleared genetically, if you have a different cytochrome system than other people, and that's why some people, I did supplements last night, I talked about that. That's why some supplements work for some people and they don't work for other people. And some people need higher doses of pain meds, and some people take a little bit and they're like, flipped out. And so the way your liver processes things is critical. And so if you have somebody that has that cytochrome system that's not working to their advantage when it comes to medications like this, you're going to have toxic effects. You're going to have muscle aches. You're going to have your liver enzymes are going to get elevated. You're going to hurt all over. You're going to feel like crap. You're going to be tired. You're not going to want to get out of bed. And cognitive decline is so interesting because we have almost 60% of women over the age of 60 have significant cognitive decline. That just means you got brain fog or you can't remember crap. Your brain is like 70% cholesterol. Like, please, for the love of God, don't block your cholesterol. You need it. You absolutely need it. If you're on statins, it's scary. Yeah, it's scary. It is scary. Okay, so anyway, enough of this scary. So there are risk factors for heart disease, and the number one is low estrogen after menopause. So we'll just get that off the table. But I want to talk about some of the other things so you can reduce your risk and some other things that you can do as well. Okay. So we've just established that you need your cholesterol. Now, here is something else that I think will really, 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 really freak you out. Oh, I'm going to talk about LDL too, I promise. I love your questions because it's like, I know I'm on the right track because we're talking about all this cool stuff. Okay. 75%, I love percentages, right? I promise you, I get this data off of different peer-reviewed journal articles. So Cardiology Association, the DIM, all the things. 75% of people who have heart attacks have, wait for it. Are you ready? Wait for it. Yes, this is recorded. Rabbit. Yes, or is it squirrel? I think it's squirrel. Squirrel. Yeah, so I'll repost it tomorrow. Okay, are you ready? 75% people who have heart attacks and strokes have normal cholesterol. That's nuts. And that comes straight up. I mean, Google it. Go right now if you want. No, don't go yet because I have to ramble about a few more things. But go Google that after we're done. Like how many people? I know what? I know. Go Google it because it's like you will be blown away, and it's not even stuff they're trying to hide over like the second or the third page on the Google search. I mean, it's like it's right there. Like how did we miss that, right? And get this. If you want to know why they're not talking about this, this is the real kicker here. There are over 100 million prescriptions for statins, which block your cholesterol, written every year in the US. 100 million. Do you know how many people are in the United States? 300 million. Well, 333 million. That's kind of the estimate. Where did I find past sessions? Yeah. So my moderator will tell you, I like repost them. So go to my bio, my whole page with all my videos, and that's where I repost them every day. So, and I usually put like a little live thing. I'll put like live repost replay. Okay. A third of people in the United States are walking around either with a prescription on file at the pharmacy because they were like, holy crap, I'm not doing this, or they're taking them. And now, oh my gosh, now with all these guidelines, and there's certain words I can't say, but these, once you turn 65 and you go for your physical, right? Because you want to get your insurance, the first thing they do is check a cholesterol level. And it's going to be high, most likely. I mean, they have changed the numbers over the years. It used to be a total cholesterol of 400, and then it was 300, and now it's 200. And the numbers for the LDL have actually gone down. And so now it's like, now we treat at this level, at this number, right? That is just unbelievable. And I want my hormones. I do not want to stop. I don't want that to happen. And I'll tell you a personal story. My mom had a friend who was a college professor. He was in his probably 60s or 70s, very, very intelligent, very sophisticated. Lost his mind, lost his memory, actually tried to strangle her. I'm not making this up. This was like 15, 20 years ago. And the only thing that had changed is he had gone on a statin 2 weeks prior. In that amount of time, 2 weeks. That's crazy. So anyway, they have so many side effects. So what I was talking about is the way it goes through your liver. If you can't clear it, if your cytochrome system isn't working properly, you're going to have side effects. And there are actually genetic tests that you can do that will show you your cytochrome system, your methylation system. So if you really want to know how all that is working in your system, it's nerdy science you don't need to know. Yes, thank goodness your cardiologist didn't. And there are some actually call them smart doctors out there still, thank God, or we'd all be dead. But anyway, okay, so If it's not cholesterol that's causing heart attacks, what is it? Okay, so here's where we go. And on the next little board, I'm going to pull that up in just a minute. I'm going to show you the breakdown of the lipid panel, including the LDL, the HDL, the triglycerides, and all those components. And then the reason I put that on the last board is because if you're taking notes and you want to write that testing that you can ask your doctor for, which they'll probably go, you don't need that. But anyway, yes, insulin resistance, absolutely. So this is where that plays in. Perfect timing to say insulin resistance. Okay, so this is a blood vessel, and these are red blood cells floating around in your blood. And what happens is there's different kinds of cholesterol. So there's the HDL, which is, we call it the happy, but it's the high density. And then there's what's called the LDL, which we call the low density, and we call that the lousy. But that's not true, because the LDL is actually the molecule that makes your hormones. It's actually the steroid hormone. I'm going to show you the testing in just a second, Rob, and that's on my other, I'll flip the screen in just a second so you can put it all in one place. Okay, so the HDL is like Teflon in your pans when you cook. Okay, so HDL has this nice little effect of actually, I'm going to use the term, it's not really accurate, but it's like Teflon lubricating the vessels. Because what we don't want is, we don't want things sticking in your blood vessels. Because when something sticks in your blood vessel, it blocks off the flow. And just like your pipes, your water pipes, if you get lime in your pipes and you get a blockage, you're going to get poo in your bathroom, right? So that's the end point. It actually did happen one time. We have a septic tank, and it hadn't been like, I can't even, but yeah, lime got in the pipes, and yeah, bad deal. Okay, so you don't want poo collecting in your blood vessels. Okay, so HDL works like Teflon. So the higher your HDL, the better. Okay, the higher the better, right? How do you get your HDL up? Healthy fats. So your omega-3s, and I always say, like, take like 4 grams of fish oil a day. And plus it kind of works like almost like a blood thinner to keep you from getting clots and things like that. So get your HDL up as high as possible. Okay. The next thing that happens is when your blood sugar is high, what happens is sugar is very, very, HDL be too high. I don't think so. I don't think your HDL can be too high. It's hard to get it up high though. Yeah, absolutely. Brown ice. I love that. Good point. You do have to watch your fish oil if you're on a blood thinner. That's absolutely true, because it does have that. It's not really thinning effect. It's decreasing your platelets basically, and so you can bleed out if you are you decreasing your platelets basically. Or there's a whole pathway there. It's not exactly platelets, but yeah. Okay, so sugar is like acid in your arteries, and when you eat, the sugar does go into your bloodstream. But because sugar is like acid in your arteries, it can't stay there. So your body pushes out insulin from your pancreas to remove the blood sugar from your bloodstream. So, let's do blue for sugar. We love the sugar. And insulin's job is to come in, grab onto that sugar, and move it out of the bloodstream. Because if the sugar sits in there over time, it starts to cause inflammation, and it collects here and collects here. And now we've got inflammation, and the powers that be are like putting more and more sugar in our food all the time. It's crazy. There's something called the bliss point. Look that up. It's how much sugar they add to things till you buy more. It's like a marketing thing. And it's like a graph. I love the graphs. And it's like, okay, people are eating more of this white bread. Let's add some more sugar. And then like they buy more, or they're eating the spaghetti sauce. And let's keep adding sugar because they're buying more. So it's the thing. Okay, so now all the sugar is in here. Sugar. Okay, and now that sugar starts eating away at the walls, literally. And now we have irritated walls of your blood vessels. And now they're spasming. So now we have high blood pressure because now these walls are tighter now. And then calcium, I talked about supplements last night. So calcium, if it's not dietary and it's that elemental stuff, that like basically like the big raw tablets that they tell you to take, that's all marketing too, because if you don't have estrogen and you're not adequate on your vitamin D and your thyroid's not functioning, all that calcium, what color should we make calcium? Let's make it purple. All that calcium is just going to collect. So this is calcium. Can you see that this blood vessel is getting very, very loaded down with poo? Kind of like lime. I really think I like lime in a pipe. Okay. So now we have all this calcium here, and now we have parts of the cholesterol, which, and I'll break this down in just a minute, but there's something called ApoBs, and that is like a sac that your cholesterol travels around in. Now we have these sacs traveling around, and I think of it like those, what are those things at the yogurt shop that you bite into, those bobos or whatever, and they like pop in your mouth? That's kind of what hey Lisa, that's kind of what the ApoBs are. Those are basically molecule sacs that carry your cholesterol around in it. So if your cholesterol particles are moving through there and your LDLs, and they're moving back into the liver to make more hormones, that's what you want. You want that stuff moving through, and you want that cholesterol back in the liver to make your hormones. So if it's not, and those sacs, it's kind of like calcium in the arteries and the bones. And that's what tumors, I mean, you see a thyroid tumor or breast tumor and it's got calcium spiculations in it. It's like, it's not cool. So now we've got a sack of cholesterol, or a sack of poo, if you will. And so it's not the actual LDL or the HDL, it's that big sack of fat, right? So, and those big sacks actually can block. So, okay, so here's some cholesterol, here's some LDL molecules. Oh, I need to do a different color, don't I? Okay, let's do it in green. Okay, so here's these LDL molecules. And now in the ApoB, they're like in a sack. So now it's not just like you have these healthy cholesterol molecules in here. Now they're in a big sack. And so now we've got like, it's kind of like somebody left Santa left a toy sack on the porch, right? That's like a toy sack with all that cholesterol in it. That's when the problem starts in. And it only becomes a problem when you have all these other things. So you have calcium deposits, you've got irritated walls, and this is a recipe for disaster. The next piece, I'm going to turn my screen around. This is so cool. You're going to love this. I'm going to explain what happens in the blood vessel and what happens when you don't have this one hormone that is the big thing, because what happens is over time with the inflammation, these arteries actually start to clamp down. And that's when you get high blood pressure, because we want to think it's the heart that's causing the high blood pressure. There must be something wrong with the heart. It's not the heart. The heart is very rarely ever the problem. However, the heart is a big muscle because it contracts and it beats. And the vessels are muscles. There are muscles in this wall. And that's what happens with a contraction. So I'm going to tell you how the muscles are affected by our hormones. And then I'm going to wrap it up with the testing that you guys asked about. Okay, hang on. Okay, someday I'm going to get one of those boards that like change over, because that'd be super cool. Okay, so what is all this mess? This is how my brain looks. Okay, so this is a cell, and cells are in our blood vessels and our heart muscles. Every cell in our body operates this way, but this is particularly the way the endothelial, meaning the lining in our arteries, works. Okay, so this is so cool. The hormone that makes all of this work properly in men and women is estrogen. And so my other videos, I have conversations about the different kinds of estrogen. There's protective estrogens, there's E1, E2, E3. We talked about palpitations the other night, which is another whole thing, because palpitations or heart racing in women is deadly to me, because we are gaslighted and told you're just crazy. And we're like, no, we're not. Or cut out the caffeine. Or we're told it's no big deal. Most women have it. And that's true. Most menopausal women do, because estradiol has alpha and beta receptors. So those beta receptors actually act like a beta blocker. So if you're familiar with a beta blocker medication, estradiol has beta receptors on it. And so it is God's beta blocker to you. Only it doesn't cause fatigue and weight gain and like want you not to get out of bed. So it's so cool. Okay, so here's the cell. This is estrogen up here, okay? And estrogen has something called an estrogen receptor. This is E2, this is estradiol. And so it goes to this estrogen receptor and it triggers something called NOS. Yeah, I was talking about palpitations. Yeah. And that's just irregular heartbeats. And a lot of palpitations are actually related to gut health because once the microbiome's gone and it shifts your serotonin, I mean, there's so many pieces of that. If you go back and you can watch my hormones and gut, that's a great one. I talk about that. And I have one from heart palpitations the other night that you can go watch too. Okay. So once the estrogen gets in here, it triggers something called NOS. And NOS then converts into something called NO. What does that stand for? Nitric oxide. Nitric oxide. What the heck is nitric oxide? So nitric oxide is actually a molecule that gets down in the DNA, all the way down. And I think like, you know that, remember that Christmas cartoon? No, it wasn't Christmas cartoon. Horton Hears a Who. Like there's like this little who, like, I don't know. It was like these little things and they're whispering to him in his head. He probably needed to be on some Thorazine or something, or he's hearing voices. But okay, anyway. So the DNA does something called gene expression and it signals. So nitric oxide is a signaler to make your cells do this gene expression of these triggers of something called PK that actually makes your muscles in your bloodstream relax. And the thing that does that is estrogen. And after menopause, if you don't have somebody that can get you on some estrogen, please, for the love of God, that's why you start getting high blood pressure. That's why you start having heart disease. That's why your stroke, your blood vessels, your migraine headaches, whatever it is that's being affected by your bloodstream. Your bloodstream feeds every cell in your body. Your bloodstream carries oxygen, which has antioxidants, which prevent cancer. Your bloodstream feeds your kidneys. Your bloodstream feeds your skeletal muscle. Your bloodstream takes cells in and out of your bone marrow. It's so important. I can't tell you enough how important it is. Hormone tests determine. Yes. And because doctors are idiots for the most part. I mean, I'm just like, I just get so mad. And I am a medical doctor. I've been a medical doctor for almost 25 years. So I'm family medicine. I went through residency. I did all the things. And because I got blessed with a bunch of female hormone problems and hello, menopause at 55, I'm like menopause at 50, 5 years out from menopause. I'm like, this is so important. But anyway, yes, we do. So if you go to my link in bio, and what does that mean? That I never knew what link in bio was. But if you once you leave here, don't leave yet because I have really cool stuff yet to talk about. But if you go to my link in bio, you could press that little link and it takes you to something called a link tree. And there's really cool stuff in there. There's a bunch of stuff on freebies, but they're downloads and information you can read about. And I'm super proud of those things. And I'm super proud. Oh my gosh, there's a link to order my new book. It's not new, actually. It's a second edition, but it's all things hormones. And it has, you can make notes and it's all colorful and pretty and stuff. But if you don't want, I think it's $12 on Amazon or something. If you don't want to do that, there is a free download to the book. It's I like paper copies, but there is a download so you can get this, and just watch it on your computer or whatever for free. So that's totally cool. And that's in there. And then there is a link to order the test kit. So that's sort of the funnel into our program where we do individualized bioidentical hormone therapy. And you don't even have to drive to see me. You can just do the test and our experts get on the phone with you and make a plan or Zoom call and visit with you and make a plan. And then we also do health coaching and all the other things too, and all things nerdy and whatever you want to do, functional medicine. But the program is really built around just getting some estrogen in your body and progesterone and testosterone Love testosterone. I do tons of talks about testosterone too. Live in Iowa. Have my saliva consult tomorrow. Yay! Bioidentical hormones affordable. Well, it kind of depends, Haley, on what's affordable because uh, compounded bioidenticals, yes. Affordable is kind of relative. A lot of people spend, and this is a whole conversation about insurance because it makes me crazy because insurance doesn't pay for most of what I do, which makes me crazy because I'm telling you this stuff and they're telling you get on a statin, right? And so some people are paying like I have some families that are paying $1,500 a month for their health insurance. A lot of people don't realize because their employer's paying a big chunk of it, but it's like you get nothing except put on a statin and they check a CMP and a CBC and they they tell you your blood sugar is fine, your cholesterol's elevated. And before I finish this conversation about statins, I'll tell you when I was in my residency program. Okay, well, let me just say affordable is all relative, right? So my passion is to make this as affordable as possible, and that's why we're doing it on a mass scale where we can help lots of people and do the testing. And we have our doctors that read the labs, who specifically read the labs from the lab. And then we have our chemists and pharmacy formulators who do that part. So we can do it in mass for you. So it is much less than going to most functional hormone medicine doctors. And it's different because it just depends on if you want to do, if you want a painful kind of thing or, how much of a program you want to do month to month. So affordable is just we work with you wherever you are to make it affordable basically. So but what is your health worth too, right? And insurance companies are killing us here with all the meds they want to get us on and then not really helping us. So okay, Constantina, I can't talk about that. Let's see, we have more questions. Health benefits of bioidenticals. Yes. Lab order to doctor, insurance will cover lab. That is true that you can get your doctor to order labs and insurance will cover them. The problem is most doctors don't know all this stuff and most doctors don't know what to do with it. And so even if you can get them to check, it's kind of like what I talked about thyroid a while ago. Doctors would never, like if you had your thyroid removed, would never just say, oh, you don't need tested. We'll just put you on. I mean, there's a range of thyroid, like levothyroxine or Synthroid. It's a range of like 25 micrograms all the way up to 320. And a doctor would never be like, oh, we don't need to test you. Let's just put you on 320. You'd have a heart attack. You would die, right? And so it's like the doctors out there don't think that you need tested because they're like, they're not going to do anything anyway. And the most they're going to do is a patch. And it's all guessing. They're like, oh, 0.2 or 0.5 commercial medicine. I mean, it's just like if you absolutely beg because you're drowning in hot flashes and they put you on a patch, getting them to do testing. So my point is if you can get them to test, they're just going to like blow you off because they're going to be like, what am I supposed to do with that? I'm just going to put you on a pill and only if you beg me for it. So, yeah, bioidentical hormones at 72. Absolutely. As long as they're bioidenticals and as long as you get testing and it's done right for you. Triglycerides, no. Statins, no, absolutely not. Absolutely not. Lipoproteins. Okay, so I'll get back in here and I'll talk about these things just a little bit because I know you guys want me to get to that. But I will say that there's different testing too. So when you asked about a lab order to your doctor, if you're going to do the safest route, which is the topical bioidentical creams, sometimes over the counter endocrinologists to test. No, because endocrinologists are pretty much, they don't specialize in this. So, it's really hard to get, mom went to doctor. She said it would increase blood clot. Okay. Endocrinologists usually just deal with severe thyroid or diabetes. And when it comes to menopause, most of them don't know more than the primary care docs, which is they don't get any training in this in med school, which is so sad. But saliva testing, which is the home kit that we send to you, is a better intracellular test than a blood test, especially if you're going to do bioidentical topical creams. So that's why we like this. But we do have blood spots, and we can do orders to send for serum as well. But this is really good just to get somebody on a little bit of hormones to start, or a lot of hormones to start. It just kind of depends on where you are, what you need. High cortisol, yeah. So oh, on that other thing, when I said that cholesterol turns into estrogen, progesterone, testosterone, cortisol is actually a side pathway. So cortisol is a steroid hormone too. So if you're on a statin, it'll wipe your cortisol out. And that's part of the reason why you get the aches and pains, because cortisol is your natural cortisone shot or prednisone to your body. And so that's why you get the aches and pains as well. So if you're on HRT, do you have to stop to test? No. And that's one thing about the saliva, is it checks the intracellular level of the organic structure of your estrogen, progesterone, testosterone. Your endogenous, not something that you're on from the outside, basically. So yeah, even if you're on medications or you're on topical creams, whatever, I mean, it's just, it's good. Oh, good. Yeah, there are some people, absolutely. Endometriosis, that is, or endometrial cancer. It's a whole nother conversation, and I need to probably do more on the GYN cancers and stuff. If you have endometrial cancer, that means that you've been estrogen dominant for a long time. And whether that was taking birth control or whatever it was, or not hormones, that's the problem, is you've had too much estrogen. So testing is really important. Once somebody is out, or they've had a hysterectomy and the uterus is gone, now we can play in any sandbox we want to. But while someone has active endometrial cancer, then we need to check the hormones to get that balanced, right? Get the progesterone to balance out the estrogen. But when it comes to having had cancer in the past, these are protective. In every way, if you watch any of my videos, in every way. Yes, we can test thyroid. However, when we get you straight into the program, this is our we just want to make sure that you need us. I know you need us. There's no doubt. If you're watching this and you've stayed and listened to me babble on for an hour, there's no doubt you need this. But this is sort of our entry point. Once we get you in, we listen to you, and then we do the next step, whatever that is. And if you need thyroid testing, but most women who come into my practice after menopause have thyroid dysfunction because their estrogen is low, because estrogen and thyroid are not in a vacuum. They are very similar molecules, and they do very similar things with your metabolism. Once you fix the underlying ovarian failure issue, the thyroid almost always corrects out. And what I find is that doctors who don't understand that, who have just started putting people on thyroid medication, and then all of a sudden they need more, and now they're getting thyroid resistance because the thyroid stops working because it gets lazy, kind of like any other organ can. And then all of a sudden you're on 300 milligrams of thyroid, and people don't even know what their thyroid problem was, and never even had an ultrasound, never had thyroid antibodies done, never. I just can't even. I mean, it's just like, how did you end up on 300 milligrams of levothyroxine and nobody ever told you what caused it? There's 6 different types of thyroid dysfunction, and they all are treated very differently. I always say a headache is not an aspirin deficiency. A thyroid problem is not a synthroid deficiency. There's something causing that, and usually it's menopause. And again, menopause is just a year without periods. So we're talking about ovarian failure and loss of ovarian hormones. Okay, so what did somebody asked a question, and I meant to get to that. Okay, so let me go through this, and I'll come back, and my moderator can throw that question out too. I kind of remember what it was, but okay. So this is some testing that you can get, and most of this, you can write this down or screenshot it if you want. Most of this testing you can get commercial doctors to do. A lot of it, they're not going to know what to do with it. And they're just going to go, oh, you don't need that. But you're like, I have issues I am concerned. I have a family history of heart disease and heart attacks and strokes, and I would like to know this stuff. And then the problem is you have to interpret yourself. So our program does all that. We're in Arkansas, but we are nationwide. So that's what we do is we help people with this stuff too. The main thing is just to get you on some hormones so you're not miserable and like love life again. But yeah, all of this we can look at, and that's the beauty of I'm all about education. So I teach this. We have educational programs, we have coaching, we do all the things. So I think that's super, super important. That, and you're so welcome. That's it. That's part of this process because you need your user's manual for your body. Okay. So lipid panel. And LDL, that's what we call the quote lousy, but LDL is actually the steroid molecule that makes your estrogen, progesterone, testosterone. So it's not the bad guy. It's the ApoB, which is the sac. It's got a bunch of it in it. Too much of anything's a bad thing, right? So there's the ApoB. So you can get an ApoB blood test. HDL is the happy. So this is your fish oil. You want this as high as possible, and all your omega-3s and your MCTs and all that kind of stuff. Triglycerides. Triglycerides means triglyceride is sugar. That's the sugary part of your cholesterol. So, of your lipid panel, that is an indicator, and that's why we do those lipid panels fasting. Not only because your liver makes cholesterol overnight, but also because triglyceride, if your blood sugar is high, you're going to have elevated triglycerides. Triglycerides aren't so much important other than they are more dietary from the sugar that you take in. So one of the best ways to get your triglycerides down if we need to is low carbs. I always stay focused on high protein because low carb sounds bad. And fiber. So sometimes I'll even use like a prescription fiber in some of my patients if their triglycerides are very high. And that's usually a genetic thing. And if your triglycerides are too high, that does put you at risk for pancreatitis and things like that. Estrogen dominance. Estrogen influences this because estrogen is actually a steroid molecule and cholesterol is a steroid molecule. So estrogen actually is cholesterol. It's crazy. I know. Okay. So your total cholesterol is all of these components. And then what they do is they do a ratio, which is your coronary risk ratio. And if your coronary risk ratio is high, then we need to look at some of these other things because I promise you, a statin's not the answer. There's also something called a calcium score. So you can go get a CT scan and get a calcium score. That's a little extreme. But if you're really concerned and you have issues, then it's something to do. Why my cholesterol's high right alongside my estrogen? Um, yeah, so that varies. If you have estrogen dominance before menopause, yes, you can have high cholesterol. It's sort of not it's sort of backwards from what you would think, but your body sometimes will make more cholesterol because things are out of balance because estrogen dominance can be, especially in perimenopause, very erratic. That's what we define perimenopause as. One day your estrogen's here, one day your progesterone's here. Your cycles are all a mess, and so it can be a mess. Progesterone after hysterectomy, absolutely. Progesterone actually helps with sleep. It's like saying you have shoes, you don't need socks. So any doctor tells you you don't need progesterone, that's crazy. Calcium score just measures heart plaque. Yeah, that is absolutely true. I use calcium scores just to be like, have you got a mess in there or not? so I'm not a big calcium score. I actually ordered a calcium score on one of my patients probably a couple months ago, and that was just because they asked for it. So it's not something I do. Weight loss and GLPs tomorrow. Oh yeah, you guys did ask me about GLPs. I totally can do that. Okay, I'll do that. Okay, so folate B12. So this is basically the methylation cycle through the liver. And so I did genetics. Did I do genetics? I need to do genetics. Oh yeah, I need to do genetics. I thought I've done genetics in the past, but I'll do genetics. Methylation, super important because methylation is your liver's process for clearing all the stuff. So homocysteine is part of that methylation cycle. And that can be very important if you have elevated homocysteine, which then the treatment is to take methylfolate. Hemoglobin A1C is a blood sugar test. You know, we talked about sugar in the blood is very erosive. CRP is a cardiac inflammation marker. DNA testing, you can do that if you want to see your methylations and your CYP pathways. And then you can actually do nitric oxide levels through different tests. So if you want to do nitric oxide, you can do that. But I recommend nitric oxide anyway, or supplements, um, methylated B vitamins, um, TMG, which is a whole other thing, but that actually will help with this process. So a whole bunch of stuff. Hormone blood test versus mouth swab. Yeah, so B12, yeah, MTHFR if you have low folate, absolutely. In my link in bio, I actually have my methylation solution book, all things genetic, all things MTHFR. So if you're interested in that, go to my link in bio, takes you a link tree, and then I have a bunch of freebies. So I have a link to my methylation book. Vitamin K2. Yeah, for heart, absolutely. Um, hormone blood test versus mouth swab. B12. The cool thing about methylated vitamin or methylated Bs, or any Bs, is that they're water soluble, meaning your body will just urinate them out if you don't need them. So I'd rather them be too high than too low. Histamine issues, methylation can make your brain feel like it's on fire. Absolutely, it sure can. CoQ10. Yes, CoQ10 is very good, especially if you are on a statin, but please, for the love of God, reconsider that if you are. But yeah, so CoQ10 actually helps that process in the liver and through the methylation pathways as well. So I always tell everybody, if you are on a statin, take CoQ10 for sure. Lipoprotein. Yeah, the apoproteins, those are the lipoproteins. Those are the sacks. I think of it like a bean bag, with the little white things in it, or Santa sack with all the toys in it. So that's what carries that around. Okay, so I know I'm almost over time. I'm here every night at 7 o'clock. So please come back tomorrow and I'll talk about the GLPs and some blood sugar stuff. Oh, yes. Yay. I'm glad you like it. And we can talk about DHEA and all the things. I love to talk about DHEA. That's super cool hormone. But yeah, I'm here every night at 7 o'clock. So please, please, please bring your questions. And but I love to answer your questions too. So, and you guys, like, it's kind of like you get brave towards the end of the talk, and then all these questions are there, and I'm like, I want to answer all of them. So yeah, so bring your questions. Okay, go to my link in bio, order a test kit. It's like if you could get a doctor to order your estrogen, progesterone, or testosterone, it'd be like $600 or $700, but ours test kit is only $129. And my little present to you is if you use the code TikTok20, it'll take $20 off of it. So like 109, you get this test kit. And the process is you get it in the mail, free shipping. It's free shipping to go back to the lab. It's totally discreet and very easy, and no doctor's going to go, you don't need that. Sorry, being snarky. But yeah, everything from like frozen shoulder. Most people don't know that's a menopause thing, or ovarian failure thing. So I always like kind of get people with that. Urge, incontinence, chemical sensitivities, bone loss, memory problems, brain fog, dry scalp, hair, foggy, all heart palpitations, high blood pressure, everything. So you fill this out, and then you just put your saliva in a little tube. I don't know what to do with my little tube there. And then you put it in the mailer and you send it in. And then we will arrange to have one of our experts go over it with you and get a plan, get you on some bioidentical hormones. Anything else, any other testing or anything that you want to do, you could talk to them about. And we will, it's all about education and understanding your body. So knowledge is power. That's the most important thing. So think about taking your power back. And we are all about you. And number one, getting you feeling better. But number two, if that old adage, give a man a fish and it's one meal, or a woman and teach them to fish. So we want to teach you to fish. And I'm all about education. The word doctor in Latin means to teach. Docere, it's to teach. So that's your power. Education is power all the time. 7 o'clock every night, Central. And I like try to bring all sorts of nerdy science and just whatever you guys want to hear about. So I think tomorrow we're going to talk about GLPs and the weight loss shots and Kim Kardashian. I'm just kidding. But yeah, so go to my link in bio. The website is hormonebliss.com if you just want to go straight to the site. But if you go to my link in bio, you'll see all sorts of stuff. And then I've also got a little shop page in my bio link. And like if you want to get our fruits and greens or protein powders or our supplements, and they're all right there too. But start with a test kit. TikTok 20, get you $20 off. So get your test kit. And I love hearing when you guys have ordered your kit or when you started your creams and all the things. So, okay, I love you guys very much. And I know they're going to kick me off here in just a minute. And I probably need to go drink some tea because I've talked for a long time. But I will see you tomorrow at 7.